I'm Dr. Scott Fuller. I'd like to offer an update on the menstrual problems show that I did recently. And I came across an article by Dr. Michael Jurgowitz, which I thought was pretty impressive because it's something very simple that we can all do. New review demonstrates the role of vitamin D in uterine fibroids. Now, in the menstrual problems video that I did in the past, we talked about menstrual pain and heavy flow. We talked about uterine fibroids. We talked about ovarian cysts and endometriosis. Hormonal-related problems with menstrual issues. In this review on July 27th of 2018, new research from the International Journal of Molecular Sciences demonstrate the role of vitamin D in uterine fibroids. One of the most common benign neoplasms of females, affecting 25 to a quarter to 1/3 of women. Elevated BMI, age, premenopausal status, hypertension, family history, and food additives are risk factors. So take a look at that. I'm just going to back up a little bit off of vitamin D for a second. Ethnicity, elevated BMI. So we're putting on weight. Again, that's another metabolic disease. Completely, almost in every case, controllable by cleaning up diet, looking at exercise, reducing stress, taking care of your spine and nervous system, getting more rest, drinking enough water. Age you cannot control, right? Premenopausal status, hypertension, very much you can control almost all of that. Family history is very much irrelevant in this case, very much irrelevant. If you have this significant family history, it just simply means you have to work harder than the next person. That's all it means. Doesn't mean you're guaranteed to have a problem. And food additives. Food additives, once again, you look at things and eat the clean diet. Okay. Most tumors are asymptomatic. In some, they cause a wide range of symptoms: abdominal excessive bleeding, iron deficiency, anemia, pain, bloating, constipation, and so forth. There's a variety of treatments that are out there. In many cases, they cause side effects or are ineffective. Research suggests that vitamin D deficiency plays a role in uterine fibroid development. Vitamin D levels are significantly lower in patients with uterine fibroids as compared to patients without. Well, that's pretty clear. Those with uterine fibroids have lower vitamin D. Those without them have higher vitamin D. Interesting. 2009 study, researchers demonstrated a relationship between vitamin D levels and the growth of uterine fibroid cells. It talks about vitamin D3 on transforming growth factor beta pathways, and it gets pretty complicated with that. Vitamin D also functions as a potent anti-estrogenic and anti-progesterogenic compound. So it's going to inhibit being estrogen dominant, which is incredibly important for a variety of women's health issues. So vitamin D seems to be an effective, safe, and inexpensive option that can be taken prophylactically. I've talked about vitamin D for years now. We know that lots of us are deficient. We're not getting enough sun. We're not outside anymore. And for the longest time, we were told that we must stay away from the sun because of the increased risk in skin cancer. That's now controversial. My simple byline on that is no sun for most people is probably bad. Too much sun is probably bad. A little bit of sun is probably very good. I know very small numbers of people that a little bit of sun seems to be a really difficult thing. But again, that's an outlier. That's not most people. And the research out there, and if you could look on the vitamindcouncil.org, vitamindcouncil.org, there's all kinds of recommendations on vitamin D levels, getting tested, and what kind of sun is appropriate depending on your skin type as well. So there's another article about improving your overall health, tapping into your hormonal system, and possibly decreasing uterine fibroid risks with adequate vitamin D. I'm Dr. Scott Fuller.